Hi everyone, I am Dr. Grishma Vishya from Doctors Dental Care in Bangalore. Today I am going to talk about a simple but yet very important dental treatment. It is nothing other than tooth cleaning or dental cleaning, otherwise known as dental scaling. Yes, it is a very important treatment actually. Why? Because people tend to forget the importance of a professional dental scaling. Even if you brush twice a day, there are nooks and corners in the mouth which are not being touched by a toothbrush. Saliva in your mouth naturally contains calcium and phosphorus. So this calcium and phosphorus in the saliva will get deposited around the teeth and over time it gets hardened. You may see it as an yellowish chalky material along the gum line or even the inside corners of the tooth. So why is it important that you have to remove this thing in time? These hardened deposits are known as calculus, and even if it is the calcium and phosphorus in the saliva, along with that it harbors the natural bacteria which is present in the mouth. So the long-term contact of this bacteria along the gum line is not good for the health of your gums. You may notice bleeding from the gum after a long period of calculus deposition in your mouth, or sometimes even the gum line will grow down and you will see that the tooth has increased in its length. These are the few symptoms which happens because of this calculus deposition. So the bleeding of the gums is otherwise known as gingivitis. Gingivitis is the inflammation of the gums because of the presence of calculus in the mouth. In some cases, the inflammation increases and there will be pus formation in the gums. And in some severe cases, tooth may become loose and start shaking. This happens when the calculus starts growing down along the gums. So the growth of the calculus in between the tooth and the gum result in detachment of the tooth from the bone, and that is why the tooth starts shaking. So the treatment for this kind of condition is gum treatment, starting with the tooth cleaning or dental scaling. Many a times my patients ask me whether the tooth cleaning will harm the tooth. So in order to explain the thing, I would like to talk about the scaler, which is the instrument used for tooth cleaning. The dental scaler is an ultrasonic instrument which will have a vibration. They are not sharp tips. They are not at all sharp tips which are used for grinding the tooth. Instead, they have a vibration in a particular frequency. So when this vibrating instrument is kept near the calculus gets detached itself from the tooth. That is how the dental scaling is happening. So the dental scaling or the tooth cleaning is recommended to be done once in every 6 months. That will be dental scaling need to be done at least twice a year. This will help in maintaining the health of the gum as well as the tooth. Here are some of the pics which will show before and after the dental scaling procedure. The below picture shows the presence of dental calculi and the above picture is after cleanup. The reddish color of the gums are used due to gum inflammation because of the presence of calculus. Here is another examples of what we can achieve after dental cleaning. This video shows that the tip won't harm my gloves, so it is impossible for it to grind the tooth.